You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Well, today I want to talk to you about magnesium deficiency. We see a lot of that in our society where we're really overfed and undernourished. So that's a big problem in our society today. So I just want to talk about that and some of the causes of magnesium deficiencies. And some of them are pretty troubling, okay? So thanks for watching this morning. Steph, how are you? And others are coming on. Troy, Dr. Troy, how are you this morning? And I just want to do a little teaching on magnesium. Hopefully everybody can hear me and everything is good, okay? So, Ghislaine, good morning, and good to have you on. Serpa, how are you this morning? And Linda, many others are joining us this morning, Josh. And I want to talk about something that's common because in our society today, like I was saying a little bit earlier, we're overfed and very much undernourished in a lot of nutrients, but one of the most important minerals that is deficient in our soil and everything is magnesium, and your body will not work properly without magnesium. Let's look at, I've just written down here some of the causes of magnesium deficiencies. One of them obviously is our diet. Like I said, if it isn't in the soil, it's not in the food. If it's not in the food, we're not getting it. So just generally, people are very deficient in magnesium. If you got a low thyroid, if you got any kind of kidney stress, if your insulin is high, if you're dehydrated, if you have a low salt intake, I always talk about that. The biggest problem in our society today is not salt, it's sugar and alcohol, stress. If you're on certain drugs like antacids and diuretics, antidepressant pills, all these cause deficiencies of magnesium. So magnesium is think of magnesium. I like to teach that magnesium is a mineral that helps you to relax. So what's a big issue in our society today? Anxiety. Like people are secreting cortisol 24 hours a day. And if you don't sleep right, your cortisol goes up. If your cortisol goes up, you don't sleep right. Well, one of the deficiencies in anxiety, adrenal stress, is that of magnesium. Your adrenals don't work properly without magnesium. Now, here are some of the signs. I mean, obviously, anxiety is a sign. Depression is a sign that you're low in magnesium. These things should be checked out if you're... Now, here's some things that maybe you've never thought of, but the magnesium makes you relax. I used to tell that to my kids, okay? Relax, okay? You're crossing the line. Relax. And they kind of knew that daddy meant business there, right? Just, okay, tone her down a little bit, okay? And your body needs magnesium in order not only for anxiety, but for your blood vessels to relax. One of the problems that happens in our blood vessels is that they constrict, and they, over a long period of time, they constrict. This is where high blood pressure comes in when you don't have good enough vasodilation. And magnesium helps your blood vessels, the walls, the endothelial walls, to relax. This brings your blood pressure down. So here's a sign that you may have never thought of. Twitching. You ever get your eyelid just starts twitching? That is a common sign. Or any kind of facial twitch or whatever, any kind of tremor. You know, obviously, I'm not even talking about when you get Parkinson's, but if you get an eye twitch or if you get twitching, even in your face, you sort of feel like your muscles are twitching, maybe in your hand or your fingers just twitching involuntarily, that often is a sign of low magnesium. Here's another one, cramps. How many people, get cramps? And that can be caused by different things like medications and diuretics and whatever, but what the mineral that it releases the most is the magnesium. And magnesium, again, muscles relax. If they're into a cramp, you're often low in magnesium. Sometimes I'll give a patient some potassium too. One of the things in our diet that really affects magnesium is phosphorus. Like when you consume soda and processed foods, you go in the middle aisles of those grocery stores and the processed foods, and especially the phosphorus that's found in soda. So how many people drink soda? Even if it's diet soda, has phosphorus. You know what that does? It leaches the magnesium out of your body. And again, you need magnesium for your heart. Obviously, we just talked about it for blood vessels. One of the biggest things that I find in society that's just gone crazy in society today is atrial fibrillation, AFib. The heart is skipping a beat. It can go into tachycardia. It's very dangerous. A lot of people have a heart attack because they're dehydrated. And one of the things that dehydrates you, one of the minerals you're missing in dehydration is magnesium. And this is why I often get my patients not only to drink water, but to add a little pinch of Himalayan salt that'll give you the magnesium. It's a good way to get magnesium. Of course, I often have patients supplementing with magnesium because they are so low in it, especially if they're getting cramps, especially if they have anxiety, especially if they're on certain medications, even confusion. Confusion is often that with the memory, the brain. Again, the brain needs to relax. Magnesium is a central mineral for that. And for your memory too. Migraines, okay? And again, whenever I get a patient with migraines, I work backwards. I go backwards to find out what they're deficient in. Oftentimes with migraines, and it could be due to dehydration, but the mineral they're missing that relaxes the blood vessels in the brain. Vasodilation is what? Magnesium. So hormones can cause like extra estrogen dominance, of course, can be a major factor in migraines, but I always look for the deficiency of magnesium, okay? You're not sleeping well? 70% of the population doesn't sleep properly? Well, then you should look at magnesium. It's one of the things that I use with patients to sleep. Take magnesium before you go to bed at night. It's a good thing. If you're constipated, okay, one of the minerals that are often lacking is magnesium. So magnesium is an essential mineral. We're very deficient in it. We don't get enough in our diets. Most people have to supplement with magnesium because they're not getting enough. So if you're not sleeping properly and you got, maybe some of those signs that we talked about today in terms of anxiety, constant stress, twitching, muscle cramping, and things like that, good chance you're low in magnesium. Well, the thing that I recommend is taking magnesium. I like magnesium citrate. I find it's one of the best. Magnesium is great. You can take an Epsom salt bath and get magnesium salts. So that's a good thing. Maybe about a half an hour before you go to bed at night, take a nice hot, put a cup of magnesium salts in there, Epsom salts or magnesium salts, and they get right into your bloodstream through that. But I like to take a couple of capsules of magnesium citrate. I usually take about 500 milligrams, maybe up to 1,000 milligrams a day personally. And look, the only real side effect to magnesium, you're getting too much. Well, you start getting a soft stool or you start getting diarrhea. And then you just cut back. It's like vitamin C. You know, nobody overdoses really on magnesium. So this is an essential item. So thanks for watching this morning.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.